Check is 12 minutes past the hour of 10, and you're tuned into UNICAL 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment 360. We love to call it a do infotainment. It is a very special day right here in the beautiful city of Calabar. Now, today is the fourth day in the month of February 2026. I'm pretty sure most of you think that it's just a normal day, it's just a regular day, but well, I hate to break it to you that it is not a regular day. It's a very powerful day. It's a very, very strong and memorable day. Now, today marks World Cancer Day. Today is that day set aside to create awareness around cancer. Cancer is something that has, been around for a very, very long time. I'm pretty sure that some of us have people that, were affected by cancer, maybe our mothers, our aunts, our friends. We must have known someone that died from cancer or someone that is currently living with cancer. So today is that day where we set aside to, celebrate their struggles and also create awareness about cancer. My name is Ryan Henshaw, but they call me Spice of the Airwaves, and I'm your anchor for today's special episode of Cancer Awareness, where we're going to talk about everything about cancer, from prevention, diagnosis, and everything you need to know about cancer. And I have amazing people in the studio with me this morning, and together we're going to have a conversation around cancer. But before we dive into the people that we have in the studio this morning, let me quickly read out these facts to you. Now, according to World Health Organization, in 2022 there were about 20 million new cases of cancer worldwide, and nearly 9.7 million people died from cancer. Now, that goes to show you that cancer is a very deadly thing. Cancer is not something that is our friend, it's an enemy, as a matter of fact, and we have to come together to fight cancer at the end of the day. Now, I have amazing and phenomenal guests in the studio, and together we're going to talk about cancer. We're going to raise the awareness about cancer, and we're going to tell you tips on how to stay healthy and not to things not to do in order not to come down with cancer. Now, first of all, I have Professor Ima-Obong Ekanem. She's the director, Calabar Cancer Registry. She's also a chief consultant pathologist and co-chairman, Cancer Advisory Board, UCTH Calabar. Now, she's very dedicated to the fight against cancer. A very good morning, ma, and welcome to UNICAL 103.5 FM.
Thank you very much. It's a pleasure to be here with you in UNICAL Radio International.
Thank you so much for joining me. All right, next on my list, I have Pharm Ijeoma. She is the National Chairman, Oncology Pharmacy Practitioners Association of Nigeria. Additionally, she is the head, Oncology Pharmacy, UCTH Calabar. Welcome, Ma, and thank you for joining me in the studio this morning.
Thank you so much.
Amazing.
Good morning, everyone.
Good morning. And lastly, we have Mrs. Adebukola, who is the Chief Nursing Officer, UCTH Calabar. Welcome, Ma. Thank you for joining me in the studio this morning.
Thank you. Good morning.
Good morning. Now, today is a very special day. Like I said, it's World Cancer Day. And, a lot of people are very, very passionate about the fight against cancer. But I want to hear your story. Why are you very passionate about cancer? Why are you so, very invested in the fight against cancer? Let me start with you, Professor Ima-Obong.
Thank you very much. The word cancer is one of the zodiac signs that stands for the crab.
Yes.
And the crab has this very strange way of gripping things and holding fast onto it and maybe destroying it. And so this disease is a very deadly disease. And hence, a lot of people are afraid when they are told they have cancer. But we're here to inform us and to tell us that it is not necessarily a deadly disease. So we shouldn't be afraid of it. Even when you have a diagnosis of cancer made, just be assured that the treatment you'll be receiving and the care and the support from the community and the family can make you go through it and live your normal life. It's actually a chronic, non-communicable disease.
Amazing. Okay, how about you, Pharm Ijeoma? Why are you so passionate about the fight against cancer?
Well, as a pharmacist, there's a huge gap when it comes to access to quality and affordable medications for cancer patients, especially in low and middle income countries like Nigeria. In fact, the over 40% of substandard drugs occur in cancer space. So that's why I'm passionate about it, to ensure that these patients have access to quality medications, because at the end of the day, if you don't use quality medications when you are managing these patients, you are not sure of the outcome. And most of the poor outcomes we experience in Nigeria is because of the quality of medications that we're using. So I'm passionate to make sure that we give these patients access to quality medications that can ensure a good outcome for their treatments.
Amazing. That's very commendable. Okay, how about you, Mrs. Adebukola? Why are you so passionate about the fight against cancer?
Okay, let me start by saying that I'm a cancer survivor.
Okay.
This is making 10 years.
Amazing.
And I think this problem has prompted me not to see it as a problem, but to see it as a challenge and to climb up that challenge to make way for others, to make sure that people have quality care and access to all that they need to have in cancer space. And that to declare that cancer is not a death sentence. First, if it's early diagnosis, prompt and quality care, and adequate care makes life better and makes a cancer patient to be a survivor.
Amazing. We love that you shared your story with us. Thank you so much for telling us that. Okay, now let's jump right into it. Now, this year's theme says United by Unique. It's a very unique theme, a very interesting theme. So what do you understand by that theme, Pharm, Ijeoma? Let me start with you. How do you understand United by Unique?
The theme of this year's World Cancer Day is United by Unique. It's actually the second phase of a 3-year campaign that started last year. It's ending in 2027. What it means is that we are united in our global goal to reduce cancer burden, to beat cancer. We also recognize that every patient's experience with cancer is unique. Every patient's journey, medically, emotionally, socially, is distinct. And this is why we advocate for patient-centered care. That's treating the patient, not just the tumor.
That's really nice. Let me move over to you, Professor Ima-Obong. Now, tell us right now, as of today, what is the weight of the burden of cancer in this part of the world, given that we don't have so much technology and so much innovation to fight this disease? So what is the weight of cancer? What's the burden of cancer today in this part of the world?
Well, thank you very much for that important question. The burden of cancer is very high in our part of the world, which is a low and middle income country. In fact, about 70% of cancers are found in our part of the world. And interestingly, majority of these ones are in the advanced stages, meaning that the patients may end up losing their lives. And so we find that late diagnosis plays a very significant and important part in terminating the lives of these patients prematurely. And the burden of the cancer here is also complicated by some of the lifestyles that we see people express here. For instance, the issue of having to have an annual medical examination is very tough. And so most of those patients who could have been picked up early are not, because many are not aware of the early warning signs of cancer. So the high burden results from the lifestyles, the poor knowledge, the lack of awareness of available screening and treatment options. So it is important that we know the risk factors also, because these contribute significantly to the high burden. For instance, many cancers, up to 30 to 40% of cancers are preventable, which is very good. But the high risk factors may not be known by the people. So we need to tackle these preventable factors. For instance, tobacco exposure and use is the number one most preventable cause of cancer.
Okay.
This is followed by chronic infectious diseases like schistosomiasis that causes bladder cancer, like hepatitis that causes liver cancer, and gastritis, which is inflammation of the stomach that causes gastric cancers.
Okay.
Now, these chronic infections must be tackled, and they're very common in our tropical environment. And then abuse of alcohol or harmful use of alcohol. A lot of people like going out to the pubs. After the close of work, they want to relax. They sit around beers and drink and get stupefied, indirectly destroying their lives. So they need to know that alcohol consumption is detrimental and can make a high risk of cancers, and also sedentary lifestyle.
Okay.
People who work in the blue-collar job industries hardly move around. And so there's need for regular exercise to keep down the risk of obesity, which is one of the high-risk factors that can make the number of cancers very high in our part of the world.
Okay, we're going to talk more about the preventive measures, later in the session. Now, let me move over to you, Mrs. Adebukola. Since you are a cancer survivor and also a medical practitioner, I'm pretty sure that in your line of work and experience, you've heard about a lot of misconceptions people have about cancer. Some are ridiculous. Some you ask yourself, how did you even come about this kind of misconception? So, what has been the craziest misconception that you've heard people have about cancer?
One of the craziest is that you are being bewitched with cancer. And in this part of the world, we believe that everything, even if you drink water and you choke, they believe that it is that somebody somewhere is remoting something, and you are now showing the physical manifestation. We are not saying there are no spiritual things. There are spiritual things that can. What I tell my patients is that there are spiritual things that can manifest as physical things. We know, but since the physical has manifested, be battling the physical, the spiritual, then we go forward and tackle that physical. Don't leave any of the two. We are not, since you believe in that. So they believe in is a witch, you are being haunted by it, and this situation of God forbid is not my portion. In maybe our religious circles, some people will say it cannot happen to you. It is not. You are secured. It can happen to anybody. So far you are a man, you are a woman, you are a child. So far you are born. Even in vitro, a child that is not born in pregnancy, some children in vitro has cancer even before they are born. So one of the misconceptions is that it is not, you need to live well and enjoy your life. And by enjoying your life, you are predisposing yourself, exposing yourself to some dangerous chemicals, some dangerous things. And they say, man must die anyhow. Man must die anyhow. And that's one of those things that we are talking about. Lifestyle. Our misconception. Somebody can sit down and eat a full pot of dog meat. And you don't even consider that. What are those things that they use in preparing the dog meat? I know that alcohol is one of those things they use in preparing it. And by the time what you consume, how you live. So most of the conceptions is just around us. It's just around us. And if we don't live above these misconceptions, we continue to wallow in the number of cancer cases in this part of the world.
So even when you try to educate, some of these cancer victims, right? Is there any time that they tell you, I'm not hearing what you're saying, this is what I believe in? They become very, very aggressive and don't want to buy your own medical advice?
Yes, there are instances, but your approach matters. If somebody knows that where you are coming from, I've passed through this road, and I know this happens, and you don't condemn them outrightly, on their belief. That's your belief. But what I'm saying is that what you are saying, the spiritual, I'm not asking you to leave the spiritual. In fact, they should come and pray with you.
Okay.
But you must not go and stay on the mountain for 3 years when the cancer is growing. And when it has now grown to the extent that it's taking your life, that's when you come to the hospital. No. Tackle the spiritual. Be praying wherever you want to pray. Let people come and pray for you, even when you are in the hospital. But come, let's do the treatment. When you are diagnosed, don't run away from the treatment. If you prayerfully do the treatment, you are a survivor. You have survived. You are living, and nothing stops you. Nothing can. I can tell you that in this, after cancer, I know what I've done in 10 years. And I can tell you that God is faithful. In 10 years, I've had let me say 2 degrees added to my own. I have a specialty. So many things I've added to myself. Cancer had put me in places where other things, by God's grace, has not placed me. And so if we remove all these conceptions, we are good to go.
Amazing. At the end of the day, we can both tackle it spiritually and physically, and everyone is fine at the end of the day. Okay, let me move over to you, Pharm, Ijeoma. Now, people always say that the first fight against cancer is early detection, right? When you're diagnosed early. Now, why is it that it's still very difficult for people to get diagnosed on time in this part of the world?
Well, in Nigeria, we are still facing late presentation as a major challenge in cancer care because most of our patients present very late. The challenge to early detection is fear.
Okay.
And stigma. And people are afraid. Even when the cancer is detected early, you see them disappear. They won't even come. They don't want people to know they have cancer. They don't want to seek treatment. They are afraid of stigma. So the challenges are enormous. Sometimes it could be because they don't have access to screening facilities around, especially for those in the villages. They don't have access to mammograms. They don't have access to labs where they can do simple PSA tests for prostate cancer.
Okay.
They don't know. They don't have the knowledge of how they can do simple self-breast examination or testicular examination. That is why we are here today, to create more awareness and let people know that there are red flags that they can, use to know that when they see these things, that they need to see their doctor. Symptoms like when you see changes in your bowel movement or your bladder habits, you have a constipation or diarrhea that have lasted for weeks, or you have a sore that has refused to heal, or you have a bleeding, unexplained bleeding or discharge, like blood in your stool or in your urine, or you're coughing up blood, or you're having bloody nipple discharge, you need to see your doctor. Or you have thickening of any part of your body, or lump in your breast or in your testicle, or anywhere in your body there is a thickening, abnormal thickening, you need to see your doctor. Or you notice something like the normal mole on your body, notice some obvious changes on the mole, you need to move, because these are early signs. It's not that these signs it doesn't mean that you have cancer when you have these signs, no. But what your body is simply telling you is that there is something abnormal and you need to investigate it. So you need to come to hospital, because like we always say, early detection saves lives.
So you always speak about, I hear cancer activists always speak about early detection. Now, how affordable is this early detection at the end of the day? Because that would also influence the number of people that will come for screening.
Things like self-breast examination is free.
Okay.
You're doing it yourself. For self-breast examination, it's normally advised to do it after your period, at least once a month. You know your body. Look at your breasts. Check for changes in color, changes in size, in shape. check for any dimpling or flaky skin, check if there is lump or thickening of the breast, check if there is nipple discharge. You check as far as the armpit area, that's your axilla, because that's part of your breast.
Okay.
And if you notice any changes, then you come to hospital. Things like breast ultrasound is around 3,500. That's not too much. It's affordable.
Okay.
Mammogram is around 10,000. That's not much. And mammogram is for women above 40 years.
Okay.
Then you have pap smear. Pap smear for women above 25 years. Pap smear is affordable. Sometimes they even do it free.
Okay.
During programs like World Cancer Day, you see organizations doing it free. So you can do pap smear. You can do simple PSA blood test for men from 45 years and above. These screening tests are quite affordable. Yes, they are.
Okay, so in rural areas that you spoke about where they don't have these technologies and facilities, what steps are they making, health organizations, to ensure that they have the equipment and technologies for this early screening exercises?
I know that in some health centers, the community health extension workers are trained, even community pharmacists are trained to be able to detect early signs, so that they can refer these patients to facilities where they can access help earlier, to do further tests. Because some of these red flags can actually be noticed even without any big lab tests. You can notice the symptoms and the signs, and you can refer the patient for further tests. Okay,
we're still talking about World Cancer Day right here on UNICAL 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment 360. We love to quality aid you infotainment. We're going on a very short break now. When we come back, we're still having the conversation around cancer right here on UNICAL Radio. I'll leave in the hands of Sia. This one says, the greatest. Do not move away from your radio set.
Receive the measles rubella vaccine. Every child must complete the routine immunization, and every 9-year-old girl must receive human papilloma virus vaccine to prevent cervical cancer. The Cross River State government will conduct a statewide vaccination campaign to protect children across the state from these deadly diseases from 4th through 13th February 2026, plus a 2-day map up which will end on the 15th of February 2026. All health facilities, schools, churches, mosques, palaces, households, motor parks, markets, shopping malls, and all places where eligible children can be found for the vaccination. After the campaign, routine vaccination continues in all health facilities. Vaccines are safe, effective, and already paid for by the government. Don't wait. Visit your nearest health facility or any vaccination site. Leave no child behind. This message is brought to you by the Cross River State Primary Healthcare Development Agency with support from partners.
UNICAL 103.5 FM, bringing to you entertainment, infotainment, and edutainment all round the clock with profound, trusted, and reliable hosts. Stay posted by tuning on to your radio 103.5 FM or visit our website at yrka.org/UNICAL Radio. UNICAL Radio, education beyond barriers.
The best radio station in the world.
Take your eyes
For the very best in music, information, entertainment, and education, stay locked onto UNICAL Radio International, 103.5 FM.
You watching me. This is never ending. We have been here before, but I can't stay this time 'cause I don't love you anymore. Please stay where you are. Don't come any closer.
Love in the Dark by Adele. Welcome back from that break. If you're just joining us, it's UNICAL 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment 360. We love to call it ADU infotainment. And today we're talking about the World Cancer Day. We've spoken about, misconceptions. We've spoken about, early screening. And we also have a lot of things to talk about still on this session. But before then, right, let me quickly ask this very funny question, but I'm just going to ask it regardless. Now, Pharm, Ijeoma said something about stigma. Now, Professor Ima-Obong, you said that, cancer is non-communicable. So if it is non-communicable, why is there a stigma?
Very interesting question. When patients have cancer, you can actually see them look very lean.
Okay.
Some gets very dark and ugly. And somebody seeing them might think there has been a bewitching done. And they would be stigmatized against.
Okay.
So the actual physical appearance of a patient who has cancer. Especially the advanced cancer, can make them look very ugly and unpresentable.
Okay.
So that stigma comes as a result of the effect of the cancer on the body.
Okay.
And remember that cancer affects all tissues of the body, various sites. And so the manifestation would vary depending on the site. For instance, if it's a childhood cancer, like a lymphoma called Burkitt's lymphoma, it would make the jaw of the child very swollen, and that child will look ugly. And people can start complaining, oh, maybe this child is a witch or something. And that could make the child become withdrawn. And so stigmatization sets in. So it's actually the physical appearance of the cancer patient that can make them look very unpresentable. Also in women who have cervical cancer that is advanced, one of the signs is that they would have malodorous, very offensive discharge. And anytime you approach a patient with cervical cancer, just the odor alone around her, very offensive, can make her be detested, even within the family. Same thing goes for breast cancer that is advanced. Very painful, ugly, ulcerating, foul-smelling ulcer of the breast. And many times the ulcer oozes out blood or some funny-looking fluid that can discolor the breast, the skin, and then the clothing would be soaked up. And that can make the patient look really very ugly. And so the advanced cancers make patients very unpresentable, very ugly, not to talk about the pain they go through.
Well, at the end of the day, it's very sad that, these patients have to go through all of this, and stigmatization is a very bad thing. Stigmatization and segregation is a very bad thing, but people should also know that these things are not communicable. You cannot get them by looking at the patient or by associating with the patient. Okay, let me move over to you, Pharm, Ijeoma, again. Now, what are some environmental and daily activities that can expose individuals to cancer?
That's what we call the modifiable risk
Okay.
factors. They fall under the environmental factors. Prof has mentioned some of them. That's tobacco use and exposure. Tobacco smoke has been known to contain over 60 carcinogens. 60 carcinogens.
Oh, wow, that's a huge number.
So, and is responsible for up to 22% of cancer deaths.
Okay.
Tobacco use. That's to tell you how serious it is. Another major environmental factor is exposure to toxic chemicals, like pesticides, and smoke soot from illegal refining, and so many toxic chemicals that we find around, in our environment and even in our food. These days we are seeing our market women putting textile dye in red oil that they sell in the market, and they use chemicals to ripen fruits that they sell. They use these toxic chemicals without actually knowing the effects that these chemicals can damage your DNA. The major cause of cancer is DNA damage. So when these chemicals damage your DNA over time, the DNA damage accumulates and it will trigger cancer. Another major environmental factor we have is chronic infections, like HPV infection. That's why we are advocating for HPV vaccine, which is free and is available. It has been included in our routine immunization schedule for Nigeria. So for girls between ages 9 to 14 years. And you have hepatitis B virus infections, B and C infections, and there is hepatitis B vaccine. So we encourage people to get tested so that they can take the vaccine series. Then you have alcohol consumption, excess alcohol consumption. Of course, you have poor diet and lifestyle choices, sedentary lifestyle, low fiber diets, and high processed foods. These are the environmental factors that can actually cause cancer, and they can be changed. You can actually change them. They are modifiable risk factors. So we are encouraging people to make that decision today, to adopt healthy lifestyle. Yes. Make that change. Stop tobacco smoking. Stop exposing yourself to secondhand smoke, even if you're not smoking tobacco. Maybe
passive smoking.
Yes. Then, of course, reduce your alcohol intake, because alcohol has been known to cause up to 3% of cancers. And of course, get vaccinated. Make sure your children, your girls, are vaccinated. They're taking the HPV vaccine. If you're not vaccinated against hepatitis B, get vaccinated.
Okay, so Professor Ima-Obong wants to add something.
Yes, I want to add something about the environmental factors, especially linked to the diet. Now, in the markets, women like to bargain a lot to buy bulk food. And some of these bulky food they purchase may actually be already contaminated with certain fungal agents that produce toxins that are carcinogenic. A very important example is moldy groundnuts, moldy grains in general, grow Aspergillus flavus, which is a very important mycotoxin producing parasite. So this mycotoxin is aflatoxin that damages specifically the liver cells. So if you go buying maybe rotten tomatoes or rotten beans or rotten rice because it's cheaper, then you're going to expose yourself to consumption of contaminated grains and foodstuff. And that is a very strong link to liver cancer. I also want to add, because infections are very common in the tropics, and I mentioned bladder cancer. This bladder cancer is caused by Schistosome hematobium, which is a fluke worm, the bladder fluke, that is transmitted through a mollusk or a snail. Now, these snails are very rampant in rice paddies.
Okay.
So people who grow rice can get infected by this mollusk that contains this particular schistosome that infects the bladder. First will cause chronic irritation of the bladder, and eventually the chronic inflammation would transform to cancers. And in parts of the country where they grow a lot of cereals, like in the rice growing areas, they use protective wears, boots, so that the mollusk will not invade their skin. So that's part of the environmental control within the agricultural sector. They will need to use molluscides to destroy the mollusks that transmit this particular vector that causes bladder cancer.
Okay. Let's move over to the access to healthcare. Now, Mrs. Adebukola, now, access to treatment is still a very major issue, particularly in, low-income communities like ours. Now, in your experience, what are the biggest barriers preventing people from getting the care that they need?
The most important goes to finances.
Okay.
Finances in the sense that coming to where the health facility is, you need money. You need to transport yourself to come. When you come, the money that you will use in doing investigations and get the treatment. So, majorly, it centers on finances.
Okay.
Because cancer treatment is not a paracetamol treatment. It is not a 1 naira treatment. It involves a lot of money. And that's why we encourage families, we encourage churches, we encourage neighbors that be your brother's keeper. There's nothing like, and one of the misconceptions that we have is that if you help a cancer patient, he's a devourer. So he's eating into your purse. That's one of the misconceptions that is seated in our religious thing. So when they say this person has cancer, you say, God forbid, I will not put my money in it. It is not a devourer to your purse. You are helping. God is love. And when you want to show love, you can't show love to somebody that is dying and you have the money and you keep it. If every one of us can say every month, I have 1,000 naira to give to a cancer patient, it will go a long way. If 1 million people or 1,000 people can say, I'm giving 1,000 naira in a month, you will not be able to imagine how far that treatment can go. So, majorly, it is the finances. Then, 2, we have our hospitals. You see, I can say that our government, they are trying, but we are not yet there. We are not just there yet. Because when you look at the number of medical personnel that we have in our hospitals, we start with that. Then what are we going to use to work? Those things, those equipments that we need and all those things, our government needs to do better. They need to face our hospitals and do the right thing to be done. Then these drugs that they are going to take, how accessible, how affordable it is. We have so many policies, but if we don't make them to work, it will not fly. We'll still be talking about this every day. Like we have NCAP.
Okay.
There are people that can enroll. Patients can enroll under this. It's cheap, but not too cheap. We have the NHIS, where patients can individually, not just if you are working with government. Even people that are not working with government, you are on your own, you can come together and pay a token in a year. And you enroll, you register, and you can access some of these drugs. some of these drugs under this NHIS program. So when we look at all these barriers that we have and the problems that we have, is that everybody must rise up to do something. The patient himself, the family and the community, our government, the health facilities and health workers, all of us have what to do. Treatment of cancer is not out-of-pocket treatment. So if you know, oh, I want to do my birthday this year, think of a cancer patient. Oh, I want to do my wedding, think of a cancer patient. There are things you can do. There are so many money we throw into the air that can go a long way in bringing succor to many people suffering cancer. I tell you that, I was saying that even in vitro, that a pregnancy, a child that is still in, that is not born, can have cancer. So if you now go to our hospitals, you see babies, children, adults, grandmothers having cancer, grandfathers having cancer. So it is not restricted to a particular age. But if all of us join hands together and work against these limitations that are working against cancer, we'll go a long way to have respite for cancer patients.
Absolutely. We all need to come together for a common cause. Okay, let me move over to you, Pharm, Ijeoma, given that you're a pharmacist and you're also a specialist in oncology. Now, what significant achievements have been made in the pharmaceutical aspect of cancer fight?
Thank you so much for that question, because one of the misconceptions about cancer is that chemotherapy will kill you. They will tell you, don't do chemo, you will die, you know. But one of the significant achievements in cancer care is that we've moved from that era of blanket chemotherapy to precision oncology. So we are now in the era of precision medicine. So now we have genomic tests that can be done to actually determine what is driving the cancer growth for this particular patient. So when you determine those genomic markers for these patients, the treatment is selected
just for that,
that can target those markers. So this is the foundation of individualized cancer care. So we now have targeted therapies that target specific proteins or genes, in the cancer. And we now have immunotherapies that wake up the immune system. One of the things that make cancer to thrive is because it has overwhelmed the immune system. So the immune system can no longer recognize and kill the cancer cells. We now have immunotherapies that can actually wake up the body's immune system so that they can recognize the cancer cells and destroy the cancer cells. So we have precision oncology, that determines what drives the cancer growth. We have targeted therapies, and these targeted therapies are available in Nigeria. They are very much available in Nigeria. And some of them are even available under insurance, national health insurance. When Nosade was speaking, she was talking about financial barrier to cancer care. One of the major gaps is insurance gap. So many Nigerians are not registered under health insurance. And it might interest you to know that the federal government has made health insurance mandatory for all Nigerians. You must not be a civil servant to get registered. There is provision for private individuals to be registered. So if your family is not enrolled in national health insurance, please make sure you do that today. Because these targeted therapies we are talking about, you can actually access them at 20% cost under the national health insurance. It's available in University of Calabar Teaching Hospital. She talked about cancer patients, over 70% of cancer treat costs being out of pocket expenses. A single chemotherapy round can, for a low income earner, can be more than the annual income of that patient, to tell you how serious it is. So that is why you should take health insurance.
Very
serious. So in cancer care, we've really achieved a lot, In the developed countries, there is even a personalized vaccine where they can even the doctors can bring out the patient-specific tumor, customized messenger RNA vaccine, that they will inject back in the patient, that it will go and wake up the immune system to target the cancer cells and destroy the cancer. That one is not available in the
Nigeria
country
now.
but it's one of the achievements, and they've recorded so much success with it. There is even liquid biopsy that they can just take drops of your blood and test and be able to know if you have cancer. They don't need those invasive procedures like biopsy, just your blood, is not available in the country. And we in Nigeria yet, we hope that in the nearest future that we'll have access to that. So there is so much happening in cancer space. We've really come a long way, unlike what we had years back. These days, with genomic testing and precision medicine, we are achieving better outcome for our patients, especially when they come early. That's why screening is very important, because that is when you'll be able to detect the cancers early and then start treatment early, because it's not just detecting the cancer early. You need to start your treatment early as well, to be able to be sure of a better outcome and saving the lives of these patients.
Okay, I think Professor
I am really fascinated listening to my beloved sister, the oncology pharmacist, par excellence. She has made our work in pathology very, very easy. You see, the pathologist is at the bottom of making the cancer diagnosis correctly. And one of the problems we find is that cancer patients sometimes do not allow their specimens to be sent to the pathology laboratory for confirmatory diagnosis. That is one of the major problems we face. A woman may say, oh, I had a lump taken out of my breast. And you ask, what happened to the lump? What was the diagnosis? She says, oh, she doesn't know, that maybe they threw it away into the trash. So if we know exactly what cancer we're treating, the targeted treatment works. And we must be specific. That's where immunohistochemistry comes in. Right now, we do not treat breast cancers without doing breast immunohistochemistry, because you need to know the particular type of breast cancer you're dealing with. Is it a hormone receptive positive, or is it a triple negative? Because the treatments are personalized and targeted. So the laboratory is the rock bottom, solid foundation for proper patient management. And also even for screening. We talk about pap smear, which requires you collecting a sample from the cervix, sending it to the pathology lab. We do cytology. We have a nurse in the lab that helps us prepare the patient. The pathologist makes the diagnosis. Now the Federal Ministry of Health is adopting the WHO policy of discarding the pap smear method for cytology to diagnose early or screen for cancer. Now they advocate the HPV DNA testing, which is a high-performance molecular method. So when you vaccinate the young people, 9 to 14, you screen the women from 35 or 30 using this high-performance HPV DNA method. That way you'll be sure of the type of HPV vaccine you would adopt in the community. There are various types. You have the one that targets just 2 types of high-risk viruses, 16 and 18, the Cervarix. You have the Gardasil that targets more than 4 types. But without the HPV DNA molecular testing, you wouldn't know which is the correct vaccine to use. Well, gladly, the type of high-risk viruses in our environment includes the 16 and 18. So if you use the common vaccine, it would cover it. But interestingly, in this locality, a study carried out in the pathology department has also found a rare high-risk HPV. I think it's HPV DNA, or HPV 33, which is also one of the high-risk types for cervical cancer, which means the region where you're doing the screening, you need to know the prevalent high-risk HPVs so that you apply the right type of vaccination. You just don't vaccinate blindly.
Anyhow.
Yes. So that's one issue that we need to know. We need to assess what common types we have. And that leads me to the importance of family planning. You can actually screen women when they go for their family planning.
Okay.
And know if any of them has any of the high-risk viruses. They don't need to wait for a special screening exercise. You integrate the cervical cancer screening into an existing health program.
Okay.
And even for the children, you can put in examination of the eye when they go for their postnatal checks. Retinoblastoma is hereditary. It's very common. In fact, it is our number one childhood cancer in Calabar.
Yes.
From our report in the last report we had, retinoblastoma is number one. And you see these children with eyes popping out. Those cases could be picked up. And when the treatment is given, it's possible that they would save the other eye.
Yes.
So what I'm trying to say is that in screening, in early diagnosis and in treatment, the bedrock is precision diagnosis and treatment. And then minimally invasive techniques. Before now, you would have a very bloody transurethral prostatectomy, and the patients will bleed and bleed and bleed. You carry catheters, blood is going. But now they do laparoscopic treatment, minimally invasive. The patient goes in, gets the surgery done, they burn up the cancer cells, and within 2 days, the patient is up and about. So you don't need to go through 2 or 3 months in bed.
Okay.
You just do minimally invasive laparoscopic laser treatment. Same thing for the cervix. Thermal ablation for the early cervical cancers. Once you pick it up, the colposcopist is there in the gynae clinic. They do a colposcopic thermal ablation, and the patient's treatment is done. So for me, knowledge is important. And also the data we generate from the cancer registry helps to formulate policy, helps to determine the burden and the type of cancers prevalent in our environment. The Calabar Cancer Registry has been in existence as population-based since 2004. This is our second publication of our 5-year cancer incidence, and the pattern seems to be the same, that for men, prostate cancer is number 1, followed by the lymphomas, number 2, and then colorectal, and then breast in men. In women, the number 1 is the breast, followed by the cervix, followed by the ovaries and the adnexia, and then colorectal. So Calabar is almost showing the same pattern as the rest of the country, that it is the men who have the commonest, who have the most advanced cancers, and the women, the breast. So what I would like to say is that the data we generate helps the policy. And also the management, because now you can actually screen the patients when they are receiving treatment and determine the stage of the cancer. And we are advised to use standard guidelines, the NCCN guidelines. So everybody is treating using the standard guidelines, not you do your own, I do my own. There are standardized guidelines for sub-Saharan Africa for patients who have cancer. When we do that, then we get the best results. And everybody knows, even if you have had the cancer, proper management, support from the family, support from the environment, and then the government takes the policy serious. Now, HPV DNA screening is going to be made national. Imo State is rolling out the first pilot for HPV DNA screening in the country. I think Niger State will be the next to follow. Maybe Cross River would be ready, because every state has to show its readiness to key into this national project. It's a national program with the National Task Force on Cervical Cancer Elimination spearheading it. The guidelines are available. We're on for the pilot survey. So hopefully Cross River would key in and would have fewer cases of cervical cancers coming in for treatment.
Amazing, amazing. You spoke about support. Now, Mrs. Adebukola said something about, spiritual angle of cancer, physical angle of cancer. Now, let's look at it emotionally. As much as it affects, the physical body, it also affects the emotions. Now, are there any forms of support groups, help centers that, help cancer patients, through the cancer journey, maybe offering emotional support, offering, counseling, therapy, and all of that?
Well, for now, we don't have any organized patient support system.
Okay.
But in the hospital, we have trained oncology nurses who have the capacity to counsel the patients before the treatment commences, during the ongoing treatment, and even for life after the treatment of cancer.
Okay.
What we're trying to advocate is to have patient support teams within the hospitals. Maybe the breast cancer patients can have their own support group. The men with prostate can have, and then the children, maybe their parents can form. But generally, there is no such support team, which is not very good. I think it's high time the community takes it up as one of its key roles in helping the patients overcome their challenges.
Okay.
And the survivors also have a strong support group. The Nigerian Cancer Society has a coalition of cancer survivors as its member.
Okay.
Actually, in Calabar, we have cancer survivors.
Okay.
Coming together, support group, encouraging each other. We have NGOs that helps, like in our office there in Teaching Hospital Calabar. At least most of the patients have a platform where they can express themselves, where we come together and we ask questions. We encourage each other. And, one of the limitations we are having is still finances, because everything still boils down back to finances, because most of these people, at times, you need to visit them, not just talking on the phone alone. You need to visit them and see how they are faring and all those things. Some of our patients take it on themselves, plus most of the oncology pharmacists, the oncology nurses comes together, do visit, just to encourage the patient, because if you don't see a patient, this patient has not finished treatment, and you have not seen the patient, what is happening? Or the one that have finished, and we have not seen for checkup. What is really the matter? We come together to encourage each other. We have NGOs that helps in it, but we ask for more. We ask for more. People can come together and help us. Some of these survivors or patients that are still on treatment, at times it might even be food. After taking the chemo, somebody has volunteered to pay. The food to eat, might even now be a problem. Another thing is where they are working, that support is not there. Like some people can just, immediately they know you are diagnosed of this, and you have not come to work 1-2 weeks, or maybe in a month, maybe you don't come 1 week. They lay you off. That's not what it's supposed to be. We should be our brother's keeper. Don't lay them off. Help them to go through this journey. Emotionally, they are already traumatized. Yes. If you remove them from work, then you are creating a space where psychologically they will not be balanced, and financially they will not be able to do anything. And the issue of depression is a very, very important thing. You see, it doesn't know status. It doesn't know age. It can come at any time. If you don't have all these supports around you, you can break down at any time. And when you see somebody just withdrawn, you know that there is problem. So we need to really embrace people around us. And if your neighbor, it used to be lively, please ask after them. Look for them. You've not seen somebody for a while, call them. Ask for them. You don't know what they are passing through. Yes. You don't know. This food you are throwing in your house might be something that will sustain another person for some days. I just pray that all of us will rise up and wake up and see this as a national thing, so that all of us put hands together for cancer patients.
At the end of the day, we should be our brother's keeper, just like you said. Okay, so let me still talk to you, Mrs. Adebukola. You are a cancer survivor. Now, for anyone listening right now who may have uncertainty, or fear about cancer, what words of encouragement, hope would you give to them to, clarify their doubt and uncertainty?
Okay, when you are diagnosed of cancer, that fear is there. Fear of unknown. Fear of where will I start from? Where do I go from where? Here. After the treatment, what comes of me? What becomes of me? That fear should be taken out. And you being diagnosed of cancer does not mean that they are giving you a death sentence. No. The only time that this can be a death sentence is if you don't take action. You don't take your treatment. You don't abide with all the medical things that they ask you to abide with. Or you start your treatment and you stop halfway. Just because somebody has told you, they are selling a supplement somewhere because that's what is raining. And after they have pumped you, collect millions from you, pump you with supplements that you come back and the stage of the cancer has, in fact, escalated. Maybe you were at stage 1 or stage 2. By the time you are coming back, you are at the end stage. Then you say, don't go to that hospital. They are just killing people there. Don't take chemo. Don't take chemo. It kills people. No, chemo does not kill. It helps you to kill the cancer cells, in as much as it might affect some healthy cells around it. But with good immunity you have, if you are eating well and you are living a good lifestyle, you bounce back and the cancer cells will die and you will live. And some people is that, God forbid, why would they cut off my breast? God forbid, why would they take something from me? I would rather return to God the way I came. Than I ask some people, which one do you believe? To have 2 breasts, live for a painful life for some time and be buried with 2 breasts. Or they cut off part of your body and you live till God calls you. Yes, we have had people 20, 30 years, 40, 50 years. I have a relation that has lived more than 40 years after breast cancer treatment. And she's still living. She should be 89 thereabouts this year. So you can imagine what this can do to us. Let us take away this fear. Let us make up our mind to have a positive outlook to life. Yes. When you speak life to yourself, you don't know what you are doing to yourself. Every day, speak life to yourself. Cancer has come, but I will be the one to see the end of cancer, and cancer will not see my hand. Not just talking, but taking actions and taking your medical treatment seriously. Don't stop halfway. Please complete your treatment so that you can have a testimony. It's always there. When you complete your treatment and you abide with what they tell you and have a positive outlook and have a healthy lifestyle, then you can win. Thank you.
Amazing, amazing. Thank you so much, Mrs. Adebukola. So as we wrap up, as we mark World Cancer Day, what actions can individuals, families, organizations, or communities make today to meaningfully support the fight against cancer? Let me ask you this, Pharm, Ijeoma.
As we mark this year's World Cancer Day, to the individual, please get screened. To the family, please support your own. Support your family member, your sibling, your relative that has cancer. You can give them moral support, you can give them financial support, you can offer to prepare healthy meals for them, you can offer to take them to hospitals and be there for them. To the organizations, please educate your staff. Knowledge is power. let your staff know the red flags, the checklist symptoms that they need to know, the signs and symptoms that they need to look out for, and make sure that they go to hospital to get it investigated. And to the community, please, let's end stigma. We need to end stigma, because that is one of the things that, is creating the barrier to cancer care, making people not to come out to access treatment on time. So as we mark this year's World Cancer Day, we are united by our unique journeys, but we share that common goal of seeing a cancer-free Nigeria, and we hope to achieve that.
Thank you very much. How about you, Professor Ima-Obong? What are your last words before we call it a day on this session?
This is World Cancer Day, and this particular theme makes it people-oriented in scope. Who are the people? You start by yourself. You must be well informed about cancer. Know what cancer is. Know what the lifestyle that can provoke development of cancer are, and also know the risk factors. Make sure you get vaccinated if you're in the risk group, like the young people 9 to 14, the women from 35, and so on and so forth. Know the type of screening you should go for. For the men, prostate cancer is number 1. If you're up to 40 and you haven't been screened for prostate cancer, please make sure you do that. Also, colon cancer is quite common here. You need to go and check. The colposcopist can do it for you in the teaching hospital. You can do simple stool tests to look for occult blood. Now, that's for the individual. Make sure your lifestyle is not one that exposes you to those risk factors like cigarette smoking, excessive alcohol consumption, loose moral lifestyle, which can expose you to high-risk HPV infections. Very important. Young people, zip up. Hold yourself. Self-control. If you do that, you're not likely to be exposed to all these things. And then to the family. Cancer is not a death sentence. There has to be empathy for the patient who has cancer. Go with him or her to see the doctor. That support by the family is very important. And let the doctor who sees this patient explain to the patient and the family member the implications of this disease and the role that the family has to play, whether financial or psychological or spiritual. Praying, the family can have an altar to pray for this patient. And then to the health facility, make sure you have all the things we need available. Not when we go for doing the tests, out of stock syndrome. Provide the necessary things for screening, for testing, and then ensure that the laboratories are functional. The pathologists have their reagents to do the immunotyping of the cancers. The radiologists have the mammography machines working. Recently, the MRI machine in the hospital has been fixed. So they can go and have the MRI done to check for the staging of the cancer. The facilities must be functional and available. And then for the community, if you have a primary health center, make sure the government posts staff to that center. Yes, community. And let the people be well informed about the cancer warning signs. Let the health workers be trained. They could have this in the school curriculum, like the College of Health Tech, this College of Nursing, the medical school. All these health workers in the primary facilities should be knowledgeable about the risk factors, the warning signals of cancer, and know when to refer patients. You don't need to see a patient who has a peau d'orange of the breast and say, oh, this is not for hospital treatment. We can treat it locally, though. Quickly refer to the secondary or tertiary center. And then to the community. Ensure your community is safe. The roads are motorable. The hospital, you have water and light supplied to them. And the community leaders should be well informed so that if there's any new policy government is bringing out, they ensure that the people in the grassroots get the information, like the vaccination we're talking about. Those community leaders are very influential. They should be taken along in whatever government policies come up. And then to the governments. They drive the policy at the highest level. If there is a willingness of the government to commit to cancer control in Nigeria, I think this is one government that has done it. They have ensured that there is a special institute, the National Institute for Cancer Research and Treatment in Nigeria now, that takes care of all the areas of cancer, from data collection to treatment to research and everything. They are doing that, and we commend them for that. But we also need to get the budget line to cover cancer. What is the percentage of the Nigerian budget in health that is appropriated to cancer management? Very little. And most of the things that are required for treatment of cancer, very expensive. So they have to look into the budget because ideally cancer treatment should be free, because most of these patients are of the low income class. So if government can make cancer treatment free, it would go a long way. So patients don't need to give excuse that there's no money to even travel, come to where they can be treated. So free cancer treatment is what I would advocate. Training of the health workers. We have a lot of specialized training institutions now for oncology personnel. If you can't train in the country, you can go outside and train. And then strengthen existing facilities so people don't need to go outside, Japa syndrome, to get treatment. Thankfully, more of those institutions are coming up. There's a private one just coming up in River State, Dr. Odile's Diagnostic Center for Cancer and Cardiovascular Diseases. They can do all the things we need for cancer patients. There's another one in Abuja, the African Center for Medical Excellence, funded by Afrexim Bank, state-of-the-art management, patient-centered, with multidisciplinary tumor boards taking care of their patients from diagnosis to treatment and then to survival and palliative care. Make sure the drugs are available. She talked about the quality of drugs. Are we manufacturing our own drugs? We should start thinking of doing our own in-house manufacturing so that we run away from having fake drugs. That is a major problem. If we can strengthen our pharmaceutical companies to manufacture things locally, the expertise is there. India is doing it. Why can't Nigeria do it? So that is an area where I think government can look into.
All right, thank you.
So that the patients who have cancer in Nigeria would get the best quality treatment, and cancer will be a thing of the past. And interestingly, July 2026 would be 20 years I was diagnosed of breast cancer.
Oh, wow.
And
You're
here
also
I
a
am,
survivor.
nearly 20 years survivor of breast cancer.
Amazing, amazing.
And so I want to tell everybody that cancer is not a death sentence. All you need to do is get it early. Mine was picked up early. And it was hormone receptor positive. I took the treatment diligently for 5 years, tamoxifen. And after that, all the checks post-treatment cleared me of cancer. So I want to thank God for life. That is testimony that tells us that if we have a patient or person-centered treatment with a very good family support, and then the community, availability of work to do, activity, lifestyle, nobody would see your back.
Absolutely.
And know that you ever had a disease
Absolutely.
called cancer.
I think Professor Ima-Obong, she saved the best testimony for last. I mean, Mrs. Adebukola said her own from the beginning, but, she saved her own for the last. Thank you so much, Professor Ima-Obong, Mrs. Adebukola, and Pharm, Ijeoma, for coming and talking to us about cancer. It's World Cancer Day, and we need to, be united from our families to communities, to schools, so even we as media practitioners, we need to ensure that, we lend our voices to the fight against cancer. Thank you so much for staying with us. It has been an amazing session. We hope to do this again same time next year when we can celebrate World Cancer Day in 2027. My name is Vine Henshaw. Keep it locked right here on UNICAL 103.5 FM because we offer the best of education, information, and of course, entertainment 360. I'll leave it in the hands of Sia. This one says unstoppable because you are unstoppable. Do enjoy this and do not move away from your radio set.